morning and welcome back. Well, June is National Post-Traumatic Stress Disorder Month, and it's an issue that's becoming more and more of a topic of conversation. And this morning, we're having a conversation about it with Gunderson Health psychotherapist Janis Elder. Janis, thanks for joining us this morning.
Thank you for inviting me.
Well, we're talking about PTSD. It's something that, it's typically been thought of as related to the military, but it's really something that's extending beyond that to other fields and other experiences as well, isn't it?
Right. I've worked at Gunderson for 33 years, and I work with the Sexual Abuse Counseling Support Program. So we do see it a lot with our children who've been sexually abused, adult survivors of childhood sexual abuse and recent sexual assault. But we also see PTSD with, people that have had car accidents or major traumas like a tornado or anything that really puts a person that feels that they're in great danger.
Yeah, those kind of painful events can stay with you, stay with your body, even if you don't know it. So what are some of the signs that you might have PTSD?
Some of the signs that you might have is you might be avoidant of like where this happened. You may have flashbacks, you may have nightmares, sleeping disorders, anxiety, depression, and where you just can't stop thinking about what happened because you never processed it, and so you're just constantly reliving that experience, or different things are triggering you and reminding you of that event.
Yeah, you mentioned you've had a lot of experience working with people with PTSD. Now, does it seem like more recently more people are willing to come forward, or has that not changed at all?
I think people are more aware of how it's affecting them, and so they're knowing that there's people and techniques that are out there that will help them to get better. So yes, I do believe more people are coming and getting services.
Yeah, Janice, we're running out of time a little bit here, but we want to talk about some of those effective techniques that you mentioned.
Some of the things that we use would be eye movement, desensitization and reprocessing, which people have heard of as EMDR, where it actually moves the trauma from like your amygdala, the back of your brain, to the front of your brain, so that you're not constantly being triggered. We also do cognitive processing therapy and prolonged exposure, so that it's like you aren't afraid to go, like if you are in a car accident, to get back into a car, to be able to drive again. So those are some of the treatments. Mindfulness, staying present in the here and now are some of the therapies that are really helpful for trauma therapy.
Janice, we are out of time this morning, but again, I think the bottom line is if you feel like you're experiencing this, talk to somebody about it. And Janice, we thank you for talking with us this morning.